Yes, we can. Thank you.
Great.
All set.
Excellent. Okay. So, hi everyone. I'm sorry I can't see you. Can you hear me well? Okay, I assume so. I can't hear you either now. Okay, I wish I would have been able to be there in person. I really missed coming to the ULF and seeing all of you. I want to first thank Randali and Christina for inviting me to talk about the natural history study. Nicole and I had decided to talk about slightly different things. So I'm going to focus on what we're actually collecting right now. So none of my disclosure have anything to do with what I'm going to talk about today. I've been involved in the clinical trials, and I'm also involved in different foundations, and I'm also working as an editor on some journals as well. So you already heard some of this. So what are biomarkers and surrogate markers? There are things that we can look at clinically to help us understand disease progression. They can be MRI features, some of which Nicole talked about earlier, and also measuring some specific chemical in the body. The body can either in the urine or in the blood, and they are very important because these help us follow the disease and response to therapy. So the natural history study basically is a retrospective and a prospective natural history study. Retrospective being looking in the past, and prospective is actually following the patients over time. And we also have other related studies that we do to try to better understand the disease as a whole and the different characteristics of the disease. So we look at the normal developmental milestones for patients with 4H. We look at the craniofacial characteristics, the dental abnormality. We look at bone health. And then we also have studies about looking at how the patients and caregivers live with the disease and how we can help them better. So the retrospective natural history study and the prospective natural history study are done very closely in collaboration with Nicole Wolf and Alan van der Veer. And in my lab, it's done by Hilja, who's soon to be a PhD student. And we are working very closely with the Yaya Foundation. So in the retrospective natural history, we ask patients to send their charts, their medical records that we review. We ask about clinical acquired MRI, and we also do the questionnaires that we're going to talk a little bit about later. And in a prospective natural history study, we look at, we basically bring the patients in or do specific assessments remotely. We do blood and urine tests. We can do research MRI, and we also do questionnaires over time. For now, the prospective natural history study is on hold because of pandemic and also because of the lack of funds. So the database we're using for the natural history study is called LORIS. It's a database that was done at McGill, and that is an excellent database for longitudinal data collection, so data collection over time. And we are working, the grant that we submitted recently would hopefully cover for the two databases, the RareX and the LORIS database, to be able to talk to each other. And then the related studies. So we look at the developmental trajectories of patients with 4H, and that's going to help us understand how they acquire milestones, developmental milestones, and then better understand and stratify patients for clinical trials. And for this, we send you questionnaires to fill out. And for those who already did, thank you so much. Aline and Elia are both responsible in my lab. As you may know, Polar1C, which is one of the gene causing 4H, also causes a disorder that's called Treacher-Collins syndrome, which is a disorder with some craniofacial, so some facial characteristics that are specific to this disorder. So we're working on a project where we look at patients with POLR1C but other mutations in other genes, and look at their facial characteristics to try to understand if there are specificities to the facial characteristic of the patients, and that's done by Anitis. We ask you to send medical dental records for your children, as well as the X-rays of the teeth. And we also, when you come to the children, do specific pictures of the teeth, again, to better understand this specific manifestation of the disease. So bone health is a very important thing to look at, because it can lead to, if it's not been taken care of properly, it can lead to fractures and pain. So it is very important in our patient population to look into it and see whether or how we can help better. Patients with 4H are at risk for osteoporosis because of their underlying disease, because of the motor difficulties, especially when they are dependent on their wheelchair to move around, but also they also at risk because of the endocrine manifestations that are associated with the disease. So for this, we send you questionnaires again. Thank you again for the ones who have taken the time to fill them. We also have medical records relating to bone health. And for those who come to the children, we do X-rays, blood and urine tests. So we send you other questionnaires to look at how the parents and the patients live with their disease. So we look at the quality of life, and we also look at parental stress. And this project is actually to look at factors that we can modify over time to improve the patient's and the parents' journey. But these questionnaires are very focused on specific aspects, and they don't cover everything that the parents may want to say to us. So we also have just recently started work for patients and families, and that will be done with Adam, who just joined the lab. And this is again to identify modifiable factors that we can work on to improve the patient's and the parents' life over time throughout the disease course, and to be complementary to our questionnaires as well. So you may get some in the email about whether or not you're willing to have an interview with Adam or someone else from my lab, or a phone call. So it was a very short talk about just to have you informed about what we're doing right now in the lab about natural history studies. So I wanted to first acknowledge patients and families without whom we wouldn't be able to do what we're doing. I'm not going to introduce everyone on that slide because there's many people. I'm gonna just tell you that Alan Evans is the investigators that did LORIS. So his lab and my lab have been working very closely to adapt LORIS for the purpose of the clinical manifestations and the disease course for 4H patients. And international collaborators. So I wanted to highlight Adrien and Nicole, with whom we do the natural history study. But also Gwen Pingao, you'll hear about some of the work that we've started doing on preclinical work on gene therapy for 4H. These are my research staff. So I have 2 research associates working in the wet lab. I have 3 clinical research assistants. And these are my graduate students and medical students or pediatric neurology residents working on different projects. And I'm very grateful for the funds that we've had over the years for Project on 4H, but on other leukodystrophies as well. And I want to highlight the Yaya Foundation for their support for the for the mouse project and the gene therapy project, and for our very nice collaboration over the years. And I also remember very well when we were sitting in the room and talked about how a foundation would be of tremendous help for 4-H leukodystrophy research. Thank you. I'm happy to take any questions.
Does anyone have questions for Genevieve? Okay, Tammy, go ahead. How well can you hear, Genevieve? Maybe not at all.
I can't hear at all. No, sorry.
Okay, so you know what? She'd probably rather hear from you. Oh, go for it.
If you come to the front, I'll also be able to see you, and that would be really, really, really nice.
Oh, sure. Okay. Oh, sure. Okay.
Yeah. Oh, you don't have to, but I haven't seen you in so long. Hi.
Hi, Dr. Bernard.
Nice to see you.
You too. Thank you. My question was, when you see patients in Montreal, 4-H patients, you mentioned doing urine and blood tests. What are you looking for when you have those tests done?
So we, so you saw Nicole Stock talking about neurofilaments. So these are blood tests that we isolate plasma and serum, which are components of the blood. We aliquot the urine, and then we've done that over the years for several patients that we've seen in Montreal. And the hope is that we will be able to go back in time and look at a specific biomarker and then correlate this with what we have in the Loris database on disease progression. So we would hope that a good biomarker, for example, neurofilament or something else, would change over time as the patient is changing. So that when we do a clinical trial, if we want to follow this specific biomarker, we will know if the biomarker goes up as the disease progresses. We would see it go up as the disease progresses, and then we would start the potential therapy, and it would go down again. So we've been banking these samples for almost 10 years now, but we haven't looked specifically for biomarker yet.
Okay, so my question then, because we're in the US, is there a way to get them to you in Montreal, or should we come to see you so that we can also bank those samples?
So I know Dr. Van der Veer. I don't know if you're going to her lab, to CHOP as well, but I know Dr. Van der Veer also is banking samples, and Dr. Wolf as well. You're welcome to come to Montreal. We would love to see you there, but I wouldn't want you to come just to send blood and urine tests. We can arrange blood and urine tests and have them sent to us. So I think Luan is probably in the room. He knows all about how to do this. If you live close to CHOP, it may be easier to go to CHOP. But if you're further away, we can easily organize some blood tests and urine tests and then have them sent to us.
Okay, thank you. Sorry, one more question. I'm sorry if Dr. Wolf has already mentioned this. How close are you then to being able to use the blood and urine samples of 4-H patients as biomarkers?
So my lab has no funds to do this. So we haven't, we're just banking them. So we haven't worked with them yet. But like if, I know that we have two potential candidates for biomarkers. They're very, very preliminary. One is the neurofilament. The other one would be like a small RNA. So as you know, PAL2, which is the 17 subunit complex, transcribe DNA into RNA. So it is possible that some RNAs are can be measured in the blood and then can be biomarkers for disease. So we do have, that's one of the reasons why we're banking these samples, but we haven't had a chance to to look at them because of lack of funding. But if we ever have funding, then we'll have the samples. It's much easier to have the samples than to start collecting the samples when we have funds, because then we're 10 years behind.
Thank you very much.
You're welcome. I'm happy to take any other questions. You don't have to come to the front. It's just nice to see you guys.
Hi, everyone. I just wanted to let you guys know that my name is Luan. I do work on Dr. Bernard's research team. I'm a part of a research staff, and I would love to connect with you guys maybe during the afternoon or at a break or something, and we can talk more about the research. And I have a bunch of consent forms. If you're interested in participating, I can talk about that as well, and we can get everything signed and make sure everyone's set up. Okay, thanks.
Thanks, Luan.
Hi, Dr. Bernard. Mason Tallman's mom. My name's Rebecca. How are you?
Hi, nice to see you.
Nice to see you. How do we get our children to CHOP? How do we get them seen? How do we make that happen? To start collecting urine and blood and have the specialist eyes on them. Mason has not been seen by a leukodystrophy specialist in probably 10 years.
And you're close to CHOP?
We're in Chapel Hill, North Carolina, but willing to travel. I just don't know who to talk to make an appointment.
Okay, I'm very bad in geography, so you could come to us or you could go to CHOP. I think Luan can probably put you in touch. If you're closer to CHOP than to Montreal, then Luan can put you in touch with Omar, which is Dr. Vanderveer's Luan. Okay. And then I'm sure Omar would be able to organize a visit, but I'm not sure exactly how they work. As you may know, the healthcare system is very different in the US and in Canada. So I'm not exactly sure how it works, but I'm sure Omar would be able to help.
Thank you.
You're welcome.
Genevieve, there are no questions. I should look in the camera. There are no questions in the chat.
There is one in the chat. Sorry, that just came from Georgia Youth. Oh no, sorry.
Okay.
Sorry, it was a private question. I'm sorry. I'll answer that in the chat.
Okay. Well, Nicole, I'm sorry. I don't know if I thanked you appropriately. So thank you so much. And do you have Kathy, you have a question? Do you want to come up front? Or I can ask it for you too. That's okay. Sorry, I'm so sorry.
Dr. Bernard.
Yes.
Hi. You were saying that you were collecting samples, but you didn't have enough money, so you're basically banking them. How much does it cost to go to the next step?
So it depends what the next step is. The next step is to generate preliminary data. I think both Nicole and Dr. Vander and Adeline are doing that right now. I don't think they have funds either. So I think we've been working together to not duplicate the work and to make sure that we can get preliminary data for grant proposals. It's a complicated question because in order to look at your biomarkers and look into measuring biomarkers, you also have to have clinical data at the same time as you do the biomarkers. So you have to have a way to look at what's the stage of the disease at the time the bloods are taken. So so it's not just money for this that we need. We need money for a natural history study. And we've been working very closely with the Yaya Foundation to find solution to try to have those funds. But these are very expensive, especially the prospective one. So the one where you see the patient regularly in clinic, or you do remote assessments. The retrospective studies are a little less costly. They are costly, but they're less costly. And the way we've, like, even if we do retrospective studies, we have some patients that we had samples on over the years. So we'll be able to look at these potential biomarkers in a retrospective fashion. I'm sorry, it's not a good answer
No,
to your question.
Dr. Bernard, it's Ron. Can I try to tag on to that? It was a great answer because
Of
it's a
course.
hard question. The dollar amounts are really high. And it's something that, so I referred to it really quickly in my intro, and it's something that we as patients can do. Like, for example, we submitted a joint grant to the Chan Zuckerberg Initiative, another one, for $2 million to do prospective natural history work and biomarker identification. And even that won't cover all of the work we want to do. And so the foundation would sort of provide some supplemental funding on top of that $2 million but there's a lot of work to be done and lots of ways that we can go about supporting it together. And that could be fundraising ourselves, sharing our story, writing letters to the NIH. And so we're working right now on sort of a plan A, B, and C approach to try to get this work that Dr. Bernard and Dr. Wolf and also Adeline are talking about funded. And we would love to talk to you more about that and our sort of collective strategy and how we can go about working together to try to do it. So. Well, let's talk. Yeah, thank you.
There are other questions? Shannon, anything in the chat? Okay. Well, again, Dr. Bernard, Dr. Wolf, incredible, huge amount of thanks, not only for the presentation and the Q&A, but also more importantly, your work and your care for these families and the Yaya Foundation. So thank you so much, both of you.
Thank you for having us.